most welcome to our YouTube channel. Thanks for always subscribing and liking. Today we are going to discuss one of the causes of infertility, and which is PCOS, which most people call Pcos, Polycystic Ovarian Syndrome. And we have today our fertility specialist, Dr. Anthony Kaira. But together with me, I have my colleague. I will allow her to introduce herself before we proceed.
Okay, thank you, Prosi. My name is Akantora Prudence. Yeah, I'm going to be hosting with Prosi.
Okay, thank you so much. Moving on, Doctor, you're most welcome. Yes, I'm going to allow you to introduce yourself more. Tell us more about yourself as we proceed with our topic for today.
My name is Anthony Kaira. I am a fertility expert. My main area of interest is endocrinology, infertility, and endocrinology, and where we find polycystic ovarian syndrome. And I'm here to probably offer some more information that will be very necessary in the public space for people to understand it, find out if they need to do screenings, and what options are there for treatment.
Thank you, Doctor. First of all, let's begin. What is PCOS?
PCOS is an acronym for Polycystic Ovarian Syndrome. The name arises from the fact that in the early times when it was recognized, women who had an ultrasound scan and had challenges having regular menses had small superconducting cysts in the ovary or fluid sacs in the ovary, and there were so many multiple. That's why it was initially called polycystic disease, polycystic syndrome. Why is it called a syndrome? Because it affects multiple parts within our system, within our body. So it's a constellation of several things that are involved in either getting the disease or system protection. So polycystic ovarian syndrome, for just public consumption, is a combination of either two of the three things. For anyone who has challenges with missing period, or today, every 2 months, every 3 months, or once in a while, every 6 months, or sometimes once in a while. Anyone who has challenges with missing periods, and then we have an evaluation on ultrasound that finds that the ovaries have cyst, or they have features of what we call excess male hormone, which can be physical or in blood. Let us talk about physical because in blood we require screening. So, like issues with acne, because acne is like pimples, but a severe case of pimple where you really need to seek help. When you're always sorry, always painful, always need to do something, and you're way past through puberty. Because I would expect that going through puberty, which is just adolescence and all, everyone has acne, so we cannot start, and everyone is missing periods at that point, so we can't diagnose PCOS until at least 8 years after puberty has begun. So if you've gone past puberty, assumption is if you're starting around 12, 13, like 20, you need to be out of puberty, and you still have issues, and you're missing your periods, then you're likely to have this. You need to have an evaluation. When you go to see the doctor, they can go further, take off a blood test to measure these male hormones, not just by what they see physically, and see their levels and still see you. Another symptom or sign of excess male hormones is beard. Rebound is 1, 2, 3 beards sometimes. With excess male hormones in PCOS, you have a real distinct beard.
Like for me,
Yes, and even a sideburn,
Yes,
or
I've
sometimes
seen.
a
I've
mustache.
actually seen some.
beards.
No, not even that. But I've seen some lady. She's white. She has beards all over the face. She's like those
Yeah.
women. Yes, I've seen her on.
That means she also has
Good. If she's missing,
Yes, that she
Then
she
she
says
has.
that's her condition.
or she says,
Yes.
and so the 3 to 4 beards, which is quite common, is not something to worry about as PCOS. Although I can have 3 to 4 beards, I'm missing my periods, and I have an ultrasound scan that says I have polycystic ovaries.
Yeah.
So, but typical, we call it hirsutism. the male pattern distribution of hair. So either you have mustache, this one, or a beard, or sideburns, or even bald, which can be just ranging from just patches of hair loss to real male pattern distribution. So what I'm trying to say here is it's a spectrum. It's like a linear thing. You can be on one extreme end, or you can be on the other extreme. Meaning there are subtle differences between people. All identify as having PCOS. So there will not going to be that typical case where people say, not like the person you talked about, who have beard and all that. You may not find, especially in some populations, like PCOS in places like in Congo, PCOS in places like the Middle East tends to have significant male pattern hair distribution compared to PCOS in places like in typically Africa, people who are black. So like for example in Uganda, I don't find a lot of cases of PCOS in typical. Yes. But if you go Congo, like Eastern Congo, most of them have. Yes. Not even just there. And if you go to the Middle East, it's significant. Because I think these people genetically probably have a lot of hair. So if they have some other thing going on, it will be more pronounced. You see that? I am sure many of you know people with PCOS have many. It affects almost nearly 20% of people who can. But I am sure many people would have seen some typical people.
Oh, but
Not nonsense.
how about when you have one cyst and ovaries? What is that?
That's just a cyst, an ovarian cyst.
It's not because
Because they have to be multiple. In fact, when they do an ultrasound, the person doing the ultrasound is supposed to measure them and then find if they really are meeting the standards for PCOS. Not all cysts in the ovary are PCOS.
some cysts they can disappear.
Yes.
It's like one.
Yeah, yeah. Of course, with cysts, it's a bit of a complex thing because when we go cysts, we have complex cysts, we have cysts that have bled into themselves, we have clear cysts, we have cysts that could be malignancy, we have with cysts really extensive evaluation will help. The physician will help to tie a few things and say, okay, maybe let's give it a 6 month trial, maybe let's operate, maybe let's isolate, let's do this. But the polycystic ovaries, the ones that meet the criteria for PCOS, those ones come and go. But when they are there, they help you like, make the diagnosis. And whenever they improve, like for example, when you get your period normally, the cysts tend to reduce in number because they're a sign of how bad things are. Indeed, sometimes they actually measure how big is the ovary. How big is the ovary also is a sign to show how bad the disease is at the time. So when you improve actually ovarian size also goes down, the multiple cysts reduce, and so it helps also in monitoring.
So this means you can have Pcos and still have a cyst, one cyst that has overgrown.
You can have Pcos and cyst and other
And fibroids and all that.
yeah, which is quite unfortunate, but it can happen.
So does this mean that whoever misses, if you miss your periods
Regularly.
regularly, that means you have PCOS?
No. If you have a challenge of missing your periods, you need to have an evaluation because you see, like you can't ask for the ultrasound scan as a patient. The doctor has to do that for you, and then okay, yeah, you have. But what I could say where you need to really escalate is if you have missing your periods regularly and you have facial hair, which is like male pattern distribution. There you really are highly likely to have PCOS. Yes. So if you miss your periods, have an evaluation. Missing your periods with a bit of facial hair, then likely to be PCOS. And the management for the various conditions that cause missing of periods is different. That's why it's important that you see the doctor because there are cases where people miss periods, but they also have the secretion of milk and not present. Yeah, I've never seen that. I had from that scenario where someone says, whenever I press my breast, there's some milk like this, but they're way past breastfeeding. Probably the baby's probably 2-3 years now, and you're also missing. There's a condition, there's a highly elevated level of a hormone called prolactin, hormone that causes breast milk, which is supposed to only be present in your blood when you're breastfeeding.
That's
Right?
high
Prolactin.
prolactin.
If it's elevated, so it's supposed to be present when you're breastfeeding.
because this is actually, I have a friend yesterday. She called me and asked me. She stopped breastfeeding. I think like a year ago,
Yes.
but up to now she has breast milk in her breast.
She used to have a depression, so she has elevated levels of prolactin. And also another thing you need to know is that sometimes after 1 year stopping breastfeeding, how long has it been? Because if you have a husband at home who keeps stimulating the nipple, you may have the milk thing may not really stop.
Oh.
Yes, like if you bridge between stopping breastfeeding with a very active husband who is very active on the nipple, so you may find that you are still producing
still
milk
producing
because the brain
Thinks there
I
is
also
still
have a
someone
friend.
breastfeeding.
I also have a friend. She also had stopped like 1.5 years, around there 1 year. But she was staying with her husband and still the milk was coming out like it was increased.
so they need to be evaluated. That is not
So it's not good.
not normal, not dangerous. But you see, when that is happening, and then you have missing of period, it's nothing that your parents did or did not do. Something in your mother's womb happens, and like it has been written in stone. Now, the second thing that happens is what causes it to happen. So already you have a risk. For example, let me give you a very good example. Yes, like a risk for diabetes. And indeed, PCOS and diabetes are a very strong association. So you will have this risk within your gene that this may happen to you. But then something else happens in the environment that increases the risk. The commonest thing is weight gain. For a subgroup of people with PCOS, weight gain is the trick. Someone says, everything was fine. I had my periods very well. I got pregnant after conception and delivery. I gained weight and my periods never came back, even after the first week. And that usually could be that trigger. In others, it could be stress, could be dietary changes, could be another disease. But all in all, some people start with very regular periods after reporting that started. And then eventually they start missing PCOS. Others start from the word go, always never had regular menses, all through, and they still get PCOS. Remember what I said earlier? It's a spectrum. Different people, but all on the same kind of the same line, and presenting different with subtle differences in signs or symptoms. So it's a genetic condition. Don't know what causes it, but we believe that the risk causes what we call a resistance in your body to a hormone called insulin. Those not familiar with insulin is a hormone necessary in helping you utilize glucose effectively. Whenever you eat something, whenever you eat some glucose, insulin is released. Challenge is with PCOS, the body is not responding to insulin. And then your pancreas, the organ that produces insulin, just pumps more insulin. And then no response, then more insulin. Unfortunately, that insulin is affecting either and in the ovary, it is causing your ovaries to start producing excess male hormone. And one thing that people will ask, your ovaries produce excess male hormone. Why do they do so? So it so happens that we all have a woman and man in our body. And it is so interesting, right? I'm a person who's so interested in development. And we all come from the same, from the same substance. We just move left or move right. And so different parts of ourselves are important to do the job. So in a woman, the male hormones are important to be produced such that they are converted. Okay? You understand?
In women, the male hormones are there.
Yeah, so in women, male hormones will be produced.
But they are at a low
They're
level.
going to be converted into female.
They will be converted.
Into female hormone.
Yes. Male hormones are produced, then converted into
Female hormones. And then in men,
in men, male hormones stop there. But we also have peripheral, like along our body, we still convert our male hormones to female. Yes, but the levels are very low. But as I told you, very different. If you have a guy who's a bit of overweight, he has more female hormones.
Oh, these are the guys who have big bones.
Not necessarily big, but
Okay, what chubby, eh?
Not necessarily chubby, but someone who is chubby has a high chance that they are producing a lot of female hormones at the same time. Not necessarily, but highly likely. That's why sometimes you find people as they gain weight, they start having increased sizes of the boobs, which is sometimes the response to
That's
all
a
this.
hustle. That's a hustle.
There's no muscle.
So, and so we have male hormones helping produce female. Now, it's a balance, it's a very delicate balance. That is how you don't grow a beard normally, and you don't go bald. Now,
Yes, I've seen men without beards actually.
men without
But they
beard.
finally get. Like in
They
their
go for medication and get.
I think with the beard thing and men, it doesn't mean anything. What's most important is if you can get children with a beard on the beard. I think there's also genetic component. Some people have, some people have excess.
Yeah, okay.
So what I was saying is that delicate balance between male and female hormones within the ovary is very important. So when you have excess insulin, because the body is wondering what's happening, there will be an excess of the male hormone beyond what can be converted into the female. And then that messes up everything. It just makes all of the eggs in the ovary not to develop, get stuck, so periods,
Stop.
and then because of the excess male hormone, you have the acne, the what.
You start going fat.
Yes, but not that. No,
The insulin.
the insulin is not causing you to be fat.
What is causing it?
But if you have excess weight, you are further making it difficult for insulin to be utilized in your body. That's why they tell people what diabetes to lose weight because you respond to the drugs and be on maybe fewer medication, lower doses, or no medication at all. You need to be able to fewer weight. So when you gain weight, you increase the number of cells that are saying no to insulin. Because not to insulin already existed in your body at that point in time. So when you increase the number of cells saying no to insulin, insulin pumps out. Insulin is pumped more and more. And whatever is happening in your body is going to excess insulin.
So how come it is so hard when you interact with ladies who are faced with PCOS? Those who have gained weight, they find it so hard to lose weight.
And weight gain and weight loss is something that only people need to understand. Long ago we used to just say, hey, lose weight. It is you are born with the body type that you will always have. And some people's body types gain weight easily and lose weight. Don't lose weight. Others gain weight easily and lose weight easily. Others never gain weight
At all.
despite anything. So we now know there's no one size fits all. We all have different predisposition to gaining weight. Different environmental circumstances may make us gain weight. It's just good to talk to your physician and understand where you lie. And people are very honest. No one is asking you to go and hit it in the gym until you have the collapse. Because some people, they'll go and they will not lose as much weight as you expect them to lose. So there are other ways of improving lifestyle. Even when we're talking about treatment of PCOS, we want people to go and slim or just let them lose only 10%. If you say 80 kgs, you lose 7. If you're 80 kgs, you lose 9 and maintain within that range. That is enough for you to function normally and be okay and have your PCOS control. So I'm not really much of a fan of the aggressive exercise and that because most of those habits are hard to.
How about those ladies? I've also seen ladies who they have PCOS, but their weight is very
Tiny.
they're very
Yes,
tiny.
as I told you, there are very many variations on that spectrum. There's the tiny form, the lean form of PCOS, where weight. So for those people, weight loss is not gonna help.
So for them, they have
No.
They don't have to gain weight.
If they gain weight, things will get worse. So their system is super 100% sensitive. Even that small little lean weight of theirs, their resistance to insulin is so high enough to put them in the size they have right now. So those ones they can't gain, but loss won't help. So there are other modalities of treatment like we need to take. As I said, not one size fits all. So it's good to see the doctor when you think you have PCOS or PCOS periods. Have the doctor make an evaluation and then see what works. Because in my experience with PCOS patients, I don't think I have many patients on the same regimen or the same pattern of things and the same behavior change things. I tend to individualize the patient because they need to follow, and even the targets. I set funny targets for people like 120 kgs, 100, 140.
So is there a possibility of someone getting pregnant if they lose weight?
Yes, actually, the first fertility treatment, or the approach to PCOS is don't do much. Lifestyle modification, exercise, diet, exercise, and I know exercise is a big term, and people make me think, gym, what? No, 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 no. It's really for fertility. If you're
Be
sedentary,
active.
walk more. Yes, those are the things that actually improve insulin sensitivity. You know, why I'm not so much a fan of hardcore gym is because people always drop out of gym programs.
Yeah, gym
God,
it's so hard
and
to be consistent in the gym.
I always tell people you need something that you can sustain. Cost wise, effort wise, time wise. For example, you are in leave for 3 months and suddenly you hit gym, which is like every other day or whatever. Then suddenly you go back to work, you can no longer be out every other day. Now you start breaking pattern and because gym for me is the place where all your fitness is, you don't go to the gym, you just drop off the work and completely lose it. So I always tell people to look for these subtle small things that you can see and go and implement right now. I've been sending everyone at office. I take the elevator, I send everyone at office, I move out, get in my car, go home, move out. Okay, now I'm going to take the steps. Something that is sustainable. I'm not telling people to just go out there and just rip themselves apart, which is what happens. Go to the gym, you may even achieve your targets so soon, and then see you later, and you're like, I can't do it again. So there are either easier ways of getting that, but if you do reduce your weight after lifestyle modification by 10%, most of the women of people with PCOS will have their periods regular, which means they're
I think I can also start with 5 minutes of overall walk, so small exercises. Then you get used, you increase your time, like people increase. Okay, doctor, what's the treatment for Pcos?
So management of PCOS depends on the goals. Some people come with PCOS when they want to have their periods. Some come because of children. Some come because they have a big issue with the image. Some come because of the pattern issue. It's also a big issue of the image, so it depends. But the most important thing is to improve insulin sensitivity, which is insulin resistance. What's causing all of this? So one of the ways is weight loss by lifestyle modification, which is exercise and diet. If you can lose at least 10%, you're on a good path. For most people, 10% loss of their current weight will cause them to be ovulating again. And that means we reduce the level of insulin resistance. And how that happens is, remember I talked about the more cells that are saying no to insulin, now you reduce the number of those cells saying no to insulin, then insulin is a bit more sensitive, and then able to utilize the glucose and then be able to improve. Then the next part is now you tailor it depending on the needs. If someone wants their period back, you improve their insulin sensitivity. You can put them on combined oral contraceptives if they're interested in having contraceptive at the same time. Or there are other drugs that can be used that can improve insulin sensitivity. So we have drugs that are on the market like minoxidil and metformin, which is used for diabetes. Those improve insulin sensitivity and they can help someone get the period off, especially those who don't really okay with using combined contraceptives or who are not interested in contraceptives at the same time. Then, for those who come with acne and all that, of course, once again, weight loss is very important. combined oral contraceptives actually reduce acne. Yeah, they do. They actually reduce acne. There are other medicines that you can take to further help in removing that.
Combined contraceptives are family planning.
Not necessarily, but family planning, hormone combined pill, like the pill which has progesterone and estrogen, they do help with acne.
But does taking those medications reduce all the facial hair and the body hair?
It improves. First of all, it prevents recurrence.
Okay.
In case you go and they kind of cut them off, the rate of recurrence is actually not as much. If you have some kind of regimen you're on, your weight loss, you're taking combined oral contraceptives, combined hormone pill, or you're doing some minocytol, metformin, because you are improving the insulin sensitivity, which is reducing the male hormones in the blood, which are likely driving all these things. And then for things like acne, there are other treatments like, oil, doxycycline, the pill, benzoxyperoxide on the face, so many other treatments, of course, for acne as it is. Then for facial hair and other male pattern hair distribution, we have the pilation. Pilation is what people call what? What is pilation in terms of black hair? What's that? The medical term is pilation, but waxing of some sort, but it's not like waxing because you're trying to remove the hair from the root. Because when you it's laser pilation, electropilation. Like pilation is just
You pluck it out.
yeah, you get the hair. So when you destroy the follicle, the chance of the follicle regrowing another hair strand is limited. Because you want to reduce the number of times you have to shave.
Yeah.
Because still they leave those marks, even if you don't have Ovarian people with the bumps. And then for fertility, first things first. Weight loss, maybe 10% of people get the periods back. They are ovulating, they get pregnant. No intervention. If that fails, maybe there's another secondary cause of infertility than just the PCOS. Maybe the male partner has a problem, maybe we have blocked tubes, and all that needs to be evaluated. And if still nothing, and there's no problem, and it's just PCOS and loss of weight is not helping, then they can give you some drugs to increase the chance of ovulation. Minocytol is very effective in improving that. They can add some medicines and they can even give some injectables. All that is in line with improving ovulation. And then lastly, like maybe the biggest gun at the end of the journey of management is doing an IVF.
That should be the last resort.
Yeah, that's the
for
last.
PCOS
Yes, without any other.
intervention.
If there's no other problem, like the man, semen from the man, semen analysis is normal, and there's no tubal disease, uterine problems, and it's just I miss my period, that's why I cannot ovulate. Yeah, because I miss my periods, I'm not ovulating regularly, so I can't take time. Because people with PCOS actually get pregnant, but they take a long time. Because predicting the fertile window is hard when you're missing supplements. Because your fertile window, it's like, okay, now I'm starting my period, now about time for fertile window. But imagine for 2 months now, you don't know when. So you seldomly meet to try, and as such, it takes forever. And it's going to happen. That's one chance.
But how long does it take, for a PCOS person to conceive? I've been told, sometimes as you grow old, you ovary because you have someone said to something different. They have the reserve for ovaries is larger as you grow old.
The thing is this. Just for normal physiological aging for women, what you had at birth goes on reducing until you hit menopause, right?
Yes.
Doesn't mean that PCOS people have more. No. They will still be affected by the same factors. They just have issues with their shells that have eggs reaching maturity. Doesn't mean they don't die. They also die, and others start, and another wave starts, another wave starts.
So they die before they mature.
They just stuck, and then they eventually die after another wave. Don't that she has this set of eggs that has never really been ovulated for the next 100 years. No.
So when they die, they do what?
They just
die.
another wave starts. But their issue is there's a critical threshold they can't. go beyond to ovulate. So, like for normal physiological female, you have the recruitment starts, the wave goes, the man is ovulated, if nothing happens, a period, then another one, you see that. But in this scenario, they all go and stop. They are getting this. None of them is moving forward.
That's the reason when your eggs are stimulated, why like PCOS person has higher chances of getting twins, multiple.
Not necessarily, not necessarily. They actually have a high chance of getting complications from stimulation because their ovaries are too sensitive to the drug. Yeah, multiple follicles, multiple hits. Not that it's not in a good way, really, that they are very sensitive. You also use lower doses so they don't get the side effects of putting them in these drugs for stimulation. That's why I don't recommend someone who says have PCOS to go and just take any kind of concoctions. Because some concoctions are quite potent. Some herbs out there, it's really stimulating. Yes. Yeah. Medicine is definitely always for nature, right? So yeah, many women out there sometimes take concoctions, the triplets, quadruplets, and etc. But with PCOS, the risk of major adverse events or side effects that could risk their life from the medication like that, which is non-prescribed by a physician and not monitored. That's also there. I worked on some people who went out there, bought clomiphene on the clinic, or in the clinic or at the pharmacy, took twice or three times the dose, and they were in an ICU. So,
That risk of drugs
of,
because like expiry.
so what happens is, so the menstrual cycle is two halves. Half that creates the eggs, and then the half that prepares the womb, right? For implantation. That's all.
Yeah.
And they are split by ovulation. So people with PCOS, since they're not ovulating, they are stuck in half one. So half one is all about increasing in thickness of the lining. Half two is organizing it, prepare for implantation. So if you're stuck in thickness of lining, most of them will say, I miss my periods 3 4 months, but it really didn't count. It's painful. It's weeks. Because they're shedding irregularly. So they usually are prone to normal heavy menstrual bleeding, which can mean they can lose blood and require transfusion. You understand? And sometimes that overbleeding for so long can affect your sexual life, and further reduce the chances of conception. And then, if it's not treated, then that thickness that is intense can also lead to risk of ovarian of endometrial cancer. Endometrial cancer is cancer of the line. So whenever any part of our body is under constant repair without regulation, errors happen, and those errors where cancer rises. So there is thickness, month after month. Eventually an error will arise. But because you're not going in the second half, which usually organizes that whole thickness, that error will also be propagated, and then eventually it will become cancerous. Long term, of course, not like short term. But those who are under care, who are under those treatment protocols where physician is monitoring you, now back to being optimized, you're getting more ovulation in, less likely to get cancer. Another risk is diabetes. As we said, two things underpin diabetes and PCOS, insulin resistance. The more your body is saying no to insulin for long enough, your cells in the pancreas will just burn out.
The diabetes comes with high blood pressure.
In fact, people with PCOS will also have a risk of things like heart disease, pressure, diabetes.
So, what's the difference between PCOS and having hormonal imbalance? Because okay, I want to understand if you have hormonal imbalance, does that mean you have PCOS, or you can have PCOS, you can have hormonal imbalance and you don't have PCOS?
Let's consider hormone imbalance as a misnomer that we like to use to make things simpler for everyone.
Okay.
Like people saying hormone imbalance because no one likes to get to the nitty gritty, and there's no vernacular term
And
for the nitty gritty.
It sounds so
it's
calm.
quick. Hormone imbalance.
Yeah.
Hormone imbalance just basically means because If I don't tell you about the risks of drugs and then you get all this problem, I say, did I do the right thing?
No, you did.
So if I excite you about things, knowing what
Actually the risks that come
because
with
if I
it?
tell you I excite you and not tell you the risks of drugs, one, chances of one moving on to relevance is very high.
Yeah.
Because for that lady there, it was one chances that she would have a baby. But something is not all this stuff. I wish I had it. Because now I'm taking my kid. I was trying to avoid paying for it.
Actually, I wanted to. Sometimes.
By saying to you, now I'm back.
Yeah.
I even have high blood pressure.
You know, sometimes actually I thought if you went to the hospital and did IVF and it fails, you come on the same bill. You come on a you come on a totally different bill. Um, Maybe doctor something else. On PCOS, do we have different types or different stages of PCOS? Or it is all the same?
PCOS is different for everyone. And we talked about the lean type, the people who are a little bit overweight. There's so many like different types of PCOS. Like that's why you tend to individualize the program for someone. And for every individual type of PCOS, you can either have bad maladaptation, like poor control, or optimal control. Meaning, I can have my periods every month. I can even get all the kids I ever wanted in my life.
But you still
But I
have
have to say
PCOS.
this because I'm doing the right thing. Exercise, taking the money off. You know, optimize. Yes, optimize.
The people who have PCOS, okay, I'm trying to think. The people who have PCOS and they actually don't know that they have PCOS because they have gotten all they want, have gotten children, they get their periods, and at the end of the
There will be some problems and say, sometimes I miss what suffering. But what I'm saying, people with PCOS and optimizing it. Like you're out there, you think you may have it, your screen will confirm, the doctor says, do this. And then you go back. Many of my patients eventually get discharged of it. Because I want you to empower you to know your condition. I don't want to put you on drugs all the time. I want you to be able to see how I'm eating this taco, I'm eating this pizza, but my periods may just vanish all over again. So I need to eat things in moderation. And drop my physical activity. In fact, many patients will get to oh, I miss my periods, but I think I have traveled out of the country. Like, I lost my partner and things that I've been doing. I've been going through some depression, I've been overeating. So for me, I want people in the condition that is genetic and long term not to be so held in the system. Where you have to pay consultation. Oh my God. My really best way to manage PCOS is to empower you to understand it. Know how your body responds to it. And know how you can put it on. Because most of the drugs we can also buy them in. So when you have to come back to I've been seeing you for 3 years, 5 years, 10, and I'm going to continue seeing you because you have PCOS. So at one point, empowering.
it is better.
So we try as much as we can to empower the patient to know the condition, understand, and see what they can do to start. That's why
Cannot be consistent.
it is just one of those things that it's not easy.
All the problems that people with PCOS have, don't they have challenges with their mental health?
Indeed, it's actually very true. It's one facet of management that I've been mentioned. And I guess it's my bad because it's a common thing that we tend to overlook. Going through all that, at school when you're going through your puberty, you have issues with menses, or the girls are getting their periods, you have these acne issues, you have a body image, a situation going on, and then you're having challenges with your child. It is not going on, especially when someone tells you that, hey, you have this condition that's going to happen, and these are the challenges you face. And we're going to do this actively throughout your life to be optimal. It's a big load. Everyone says right there. Some people are just living normally and no problem. But I have to put in effort to be healthy, aggressive. So that stress usually causes some kind of mental health problem. So usually part of the treatment is the first of having them seek the right care. A clinical psychologist, a counselor, to help them, first of all, cope with the news get to terms with having and knowing what strategies that they need to do to be able to live an optimal life. Because without dealing with the mental health issues surrounding PCOS, which can be depression, anxiety, all other conditions, they tend not to adhere very well to the treatment. So I'm going to the gym, I'm doing exercise, I'm eating well, but I'm depressed.
Yeah.
What's going to happen? Done, you're eating well, let me go eat my
Let me go
junk,
into
to
my
hell with
junk.
everything. I don't care, I want to go see the doctor again. If I don't have pills,
It's okay.
because you are happy. Because in my experience, this news story is a shock to everyone. To parents, to couples, to women. You tell them this news, what could have done wrong? And you're like, no, it's my life. And I have to do all these things. Let me tell you, believe me or not, exercise is not something we like to do. And even eating well, isn't it?
Yeah.
Because
everyone wants to eat nice junk food.
Yeah, it's nice.
Yeah.
Actually,
we wish it was healthy.
It is an effort.
Yeah.
You put in an effort to be healthy, and it's not you don't look always happy when you are living a healthy life. Sometimes, you look a bit stressed to maintain the diet and maintain the gym, and you're running through jam. Then you hit the gym late, you have to run back to work. It is an effort to be healthy.
Yeah.
So imagine telling someone, if you do not even do it, for you now you have to do it.
Yeah, you have to do it.
No problem to wait to escalate. And so they sit and ask themselves, kids. And sometimes your partner may not understand. And then, they go through it. And it's important to link them to the right psychological help, which either a counselor, a clinical psychologist, and very good many of them actually are available on the many centers offering that kind of psychotherapy. Because I actually send them for psychotherapy, even to adopt the lifestyle modification. I set the modification and tell them to see the psychotherapist to help them cope with this new lifestyle trend. Because as doctors, sometimes we're not so good with words. And psychotherapists are well trained to, first of all, assess someone to see what are the risks involved here in taking on this new trend. Is it going to stress them and break them, or they need to make adjustments? They help. So you have to work hand in hand
with
the psychologist.
But how come most of the fertility hospitals did not have their own psychologist?
We have a psychologist at our place.
You may be one among many, but most of the hospitals, the fertility hospitals, they do not have people wrong, because all those treatments, when they are stimulating your hormones.
Messes you up.
Yeah.
I need to have all this background, big, monster that has been eating you up. Okay, the thing is, that speaks also about society.
Yes.
We do not recognize the need for good mental health. As when you wake up in the morning and tell someone, like, style up,
how is
whatever,
an African
do this, different, we still take mental health lightly, and usually that makes it difficult to identify. Even to identify with it. If someone says mental health is not a big deal, I wouldn't even know that I'm being stressed enough to do it. Then two, your community doesn't want to identify it because everyone says
you don't even think about
everyone's going
it.
to hide. In fact, I'm very sure you can ask so that you can also advise. I'm very sure.
Yes.
But you see, suicide, family,
But
most of the statistics, we will never get to know them because everything is just tight-knit.
yeah. And if someone commits suicide, after everyone will ask, but she was okay.
And
he was okay.
And whenever someone commits suicide, society fails. Every suicide case is a society's fault.
Yeah.
And we all should mourn. And dates them. Because you do not know no one knows the kind of stress that can really take you down. Everyone can. And it's important for us to recognize that. And we are custodians of each other's mental health. Even us as physicians, we need to recognize
the mental health.
Our mental health and even the health of our patients.
Yeah, because you cannot, if you're not stable, you cannot take care of the patient.
But we live in a world where it's so hard to ask.
But we can try to
just move on the streets of Kampala. People can just leave your mental stress for good thing, going in the road. What?
You go downtown, you're like, how do people live here? You live here, you got a stressful marriage, you reach there, you know, and the next day you have to go back.
Yeah, to stressful boss.
How are you?
Yeah, sometimes
Yeah.
you wonder how human beings in Uganda are managing. But the truth is, if we have advocacy for mental health and people acknowledge that they are custodians of mental health, maybe we can do it. Because then you're like, oh, maybe I'm raising my tone, and this person is sensitive to something. Maybe I need to address, you got to correct them immediately. Back and shout and sometimes someone out there is being stressed by the way you're talking. You know?
Sometimes you can't even know if you're stressing them, you're
No,
talking
so
normally.
so you need to
At
ask.
anything.
That
You need
means
to be
you need to
patient.
ask.
Ask so that they
I
can
came
tell you.
I was giving you feedback. Not that you're cringing. It was my tone. Just be a custodian. Your neighbor. Mental health.
But with this whole world, with all the things that are going on,
There's no time.
with
What are you gonna again? You know what they say?
And remember, for you'll be knowing that you talk to us calmly. So you will not, sometimes
that's
you
your
don't
calm
even-
tone.
Yeah. Yeah, that's my calm tone. Then you know that this person is offended by how you talk.
Yeah.
You see that it calm
So,
down.
so that's how the world is. But we need to be kind to each other. Our mental health is so, especially, infertility is one of the sensitive topics that someone can talk about. So, mental health is key for them because the society judges you their own way. Your family, actually, your closest people also judge you, and then we have even people who just see you walking. So the fact that you don't have a child, and then someone looks at you and calls you, "Hey, mommy," like you're moving on the street and someone gives you a book, buy for your child. That also hurts itself.
So, if you're custodians of others' mental health,
Yeah.
watch what you
Yes. Yeah. So thank you so much, Dr. Kalira. Thank you so much for coming. We appreciate, and I hope everyone has learned or will learn from this topic. If you have not gone, we have a challenge where people always think that I'm bewitched. I have, yet you have PCOS. We need let us go.
But maybe someone told you, yeah, I'll take your period time.
Yeah. So.
Or it was a coincidence that you had issues.
So let's go see doctors, specialists, and get tested so that we can be helped. With PCOS, you can conceive with with proper management. You can actually conceive. So we appreciate you. So thank you so much, our viewers, for tuning in. Keep subscribing, liking, and ask questions where you don't understand. We are always here to guide you and help you and link you to the right people. Thank you so much. Until next time. Bye.